So now we'll talk about um, this machine that is lever is basically a machine in physics that allows to rotate a rigid object. Okay, so we'll see that the types of levers that are in human body and what is their use. Some of the clinical examples here. Okay, so the first one we are going to talk about is your first class lever. Okay, so this is your first class lever. Okay, this is also called first order lever. Okay, so the first class or the first order. So how is the first class and the first order described? So this is basically when your fulcrum is in between the force and the resistance. Okay, and the distance between the force and the fulcrum is called force arm, or it is also called effort arm, and the distance between the resistance and the fulcrum is called resistance arm, or it is also called load arm. Okay, so the practical example in the human body is basically your cervical spine. Okay, so in the cervical spine you have your head, that is basically the load. Okay, and then you have the effort that is provided by the extensor muscles on the back of your neck for maintaining the positioning of your head. Okay, for maintaining the static position like you can see in this example. And the fulcrum is right here, that is basically your C-spine joints that you can see here. Okay, the distance between the fulcrum and the load is basically your load arm, and the distance between the effort and your fulcrum is your effort arm. Okay, so that's how the first order lever is usually seen in your body. When you are tilting your head front and back, you're basically working your spine is basically working as a first order lever. Okay, the practical example of this is the clinical example of this is for example, like you would know about the forward head posture. Like if you are using a lot of internet, you are like browsing, you are using YouTube. Basically, you're using a lot of like gadgets, mobile phones, TV, and internet. Then sometimes people go into this, especially nowadays. When there's a influx of a lot of information through these gadgets, people go into a condition called let me remove this fulcrum from here. People go into this condition called forward head posture. Okay, so what is basically forward head posture? Forward head posture basically is that your head moves slightly forward. Okay, let's say your head has moved slightly forward, so your load shifts there. When the load shifts, then the load arm increases. Now the load arm is here. Okay, this is your load arm now. Okay, if the load arm has increased, then even when the head of the weight of the head is the same, your effort needs to be more so that you can maintain your head posture. Why is that? Because torque is equals to R into F. If the load arm has increased, the R is increased, that external moment has increased, external moment arm has increased, that's why your external torque has increased. To counteract that torque, you have to produce an equivalent torque internally, and that can only be produced by upping the effort or the force um, from the extensor muscle. So that's why the treatment for that usually is strengthening of your extensor muscles. Okay, so that they can produce more force and they can bring back the head to its neutral position and avoid the forward head posture. So this is a very practical example of your first class lever that we have seen here. Now we are going towards the second class lever or the second order lever here. So this is your second class or the second order lever. Okay, second order lever is basically a machine that has a fulcrum at the very end. Okay, like this you can see here, and then you have a load arm, and load is in the middle, load arm, and then you have the effort arm. Okay, so you can see here clearly that effort arm is greater than that of load arm. Whenever you have effort arm that is greater than that of a load arm, then you are at a mechanical advantage. Okay, why is that? Because you can lift up the load, a heavier load, with a small effort because you have a greater effort arm. That's the principle of the torque that we have already discussed in our previous content. So the example of that this is heel raises, and your fulcrum is at metatarsophalangeal joints, MTP joints here. Okay, so the load is this one, and the effort is here. So basically your effort arm is greater than that of the load arm. Your effort is basically produced by the calf muscles. Now this is very significant here. I would ask you to get up and do a heel raise. When you do heel raise, you are lifting up your entire body, and you're lifting up your entire body by just small muscle here. Okay, calf is not as big of a muscle as quadricep is, but still you can lift up your whole body with the calf muscles, and you do that multiple times a day, and that is basically showing you that how a mechanical advantage is in second order levers, and that helps your lifting of your body. Now the third one and the last one that we discuss here is your third order lever, okay, or a third class lever. So third order lever is when the fulcrum is at one end and you have a effort arm. Effort is in the middle, as you can see, and then you have a load arm here. Okay, now you can see clearly here that load arm here is greater than that of the effort arm. So this is basically a mechanical disadvantage. Okay, mechanical disadvantage. The example of that is your elbow curls. You can see here your bicep curls here. You can see that you have an axis, and this is your effort arm here, and from the axis the dumbbell weights is this is your load arm here. So load arm is way greater than that of the effort arm. So that basically means that you have to produce a greater force to counteract the load here. So to counteract the torque that is produced by the load here. Okay. Now one thing is very interesting here that I would like to tell you guys, that most of your body levers are third order levers. That's a very important point here. Now a lot of you can think about that, is our body designed to be at a mechanical disadvantage? I would say for you guys to pause for a couple of minutes and think about this question and answer. I'll give you, and then when you replay the video, I'll give you the reason for that. The reason for that is that, for example, this is your fulcrum and this is your lever, and you have a load at the very end. Okay, and then you have the effort here. Okay, this is your E and this is your load. Okay, now this is your third order or third class lever. Most of your body has third order levers here. Now the important aspect to know here is that, for example, if you move this effort here, or your bicep, let's say you move this here, then this is the range of motion that you have covered with your muscle. However, the range of motion of the load is way greater than that of what your effort is covering. So but what basically we know here is that although at mechanical disadvantage, this sort of lever provide us a range of motion benefits. Okay, so as you can see here, with a smaller range of motion of effort, smaller effort range of motion, effort ROM, you can produce greater load ROM. So right now when I'm writing this, we do most of our daily living activities. Most of these follow this principle. So conclusively, our human body is a very complex and a nuanced structure. It's not only one factorial. There are multiple factors into it. If it's a mechanical disadvantage of effort versus load, then also it is providing the advantage of producing greater range of motion. Okay, so you can see from here that effort is in between and load is at the very end, and this load moves way more than what effort moves, what your muscle moves. Okay, so this is a very technical concept that I hope everybody is able to get and enjoy this content. Put your comments put your discussion in the comment section, and your comments and questions, and that let's make that comment section the discussion board, and I'll also come there to answer the questions. Let's go to the next content for our